Hi, I'm Dr. Margreet Wibbeling, midwife specialist and your host of the Birth and Baby show, brought to you by Sister Lillian Center and Sensitive Midwifery. We empower moms and midwives to have the best birthing and parenting experience through natural, physiological and intuitive care, resulting in birth and baby advice you can trust. This episode is sponsored by Zinplex and more specifically Zinplex 120s. Zinplex 120s is an amazing blend of zinc and selenium, two mighty antioxidants essential for maintaining overall health. Zinc, a powerhouse in boosting your immune system, also promotes healthy nails and hair. It's a fantastic supplement that supports the treatment of pimples and acne. Zinc is crucial for fundamental biological functions like DNA synthesis and cell division, influencing growth and supporting taste perception. Selenium, another potent antioxidant, shields cells from damage and supports a healthy immune system. It even has the added benefit of supporting thyroid function. This dynamic duo is your go-to for a healthier you, giving you all you need for a strong immune system. Visit www.zinplex.co.za. Also available at Dis-Chem, Clicks or your local pharmacy. Hi, welcome back to another episode, and can you believe it? We are in December, which is always the best month of the year in the Southern Hemisphere, and we are finishing off this year with a very important topic. We've been doing a little series in and around things that are difficult to talk about, but we do need to talk about them. And this episode is all about HIV and AIDS and living with HIV as a mother or wanting to be mother. And I've got a fantastic person to talk to us about this. She is absolutely wonderful and a specialist when it comes to everything HIV and AIDS. And she's going to introduce herself a little bit more in the episode, but her name is Sanele Sisiko, and you are definitely going to love this episode. So tune in and stay connected. Hi Sanele, I'm so excited to have you with me today for this very important interview. How are you doing?
Hi, Doc. I am well, and good afternoon to your listeners. How are you?
Yeah, also I'm doing very well. Sanele, I know you are quite a dynamic person, dynamic nurse midwife, and you do a lot of things. Tell us a little bit more about yourself.
I am a 32-year-old registered nurse midwife, and I completed in 2016 from the Mabatu College of Nursing, which is currently known as the Northwest College of Nursing. I worked for Department of Health for 5 years in primary healthcare. That's where I worked as a registered nurse and a midwife, assisting the general population who are living with HIV, as well as pregnant moms and children living with HIV. I'm very passionate about HIV, adolescents and youth. And after leaving Department of Health, I worked for an NGO that is called Institute of Health Programs and Systems. This was in 2021. I worked as a biomedical line manager for a program that was implementing HIV prevention services for MSMs, men who are having sex with other men. So this is a key population that is highly infected by HIV. I worked for that organization for 1 year, 3 months, and our grant ended. And then I moved on to a company that is a private company called Seed Consulting. I currently work as a quality assurance coordinator at Vet RHI in Ekurhuleni. So my job is to ensure that there is quality in HIV testing.
Amazing. Yeah, so you definitely went on a very specialized track, and I can hear, and that's why I ask you to talk about this topic, that you are a specialist when it comes to HIV and AIDS and people living with HIV and AIDS. So we are recording this interview for specifically in and around World AIDS Day, which is on the 1st of December. And that is an initiative that's been going since 1988 already. And this year's theme, it is all about global solidarity and shared responsibility, which I really like, especially the shared responsibility part, and I'm sure you do too. But just tell us a little bit, where are we in South Africa when it comes to HIV and AIDS? I mean, we've come a long way. What progress have we made, and what are the challenges?
So we truly do come a long way. I took some time and looked at our track as a country, from moving on days where we didn't have PMTCT, which is the Prevention to Mother to Child Transmission Program, from 2004 when it was first launched in South Africa. Currently, right now, we are sitting at a point where we have a drug that is called dolutegravir, which is very robust when it comes to suppressing the virus. We've significantly decreased the number of infection rates when it comes to mother and child, and that is exciting to watch as a country. A lot of people are not as hesitant to take up an HIV test anymore. Pregnant moms are taking up HIV tests. Our community is clued up about the disease and the importance of knowing your status. And truly, I think organizations as well as our communities, which our theme speaks about shared responsibility. And this shared responsibility says that it is not only the government's responsibility to ensure that we overcome this epidemic, but it is also through the collaboration of the communities and the government, and seeing our patients understanding and knowing the importance of that has assisted us in terms of achieving targets such as the 95-95-95 strategy of UNAIDS, which is 95% of people who are living with HIV must know their status, and 95% of those who know their status must be on treatment. 95% of those who are on treatment must be virally suppressed. And a virally suppressed person means that particular person cannot transmit the virus to their unborn child, their sexual partner, or anyone else. So as a country, we have really made great moves in terms of the virus.
Wow, that is amazing. That's a mouthful as well. Let me just see if I can get myself back in here. Yes. So we've reached those targets of 95, more or less.
We are still struggling with the latter 95, which is people must be virally suppressed. And there are a lot of things that are still contributing to that. On social media, I'm always calling out nurses, calling out patients, particularly in terms of making sure that people are adhering to treatment.
Yeah.
I still feel like there is a gap, Doc, that we can fill as healthcare workers and as a community in terms of ensuring that we do attain the latter 95, which is ensuring everyone is virally suppressed. If a person is virally suppressed, it means we are preventing new infections from occurring in the country. So we are still struggling with that, and there are challenges around that, such as people moving from one region to the other. Someone will move from to Gauteng without a transfer letter, and this person is visiting her husband. They conceive. She's no longer taking treatment. She doesn't go to the clinic for treatment. Viral load now starts going up, and transmission occurs between the mother and the child. And I'm always encouraging nurses on social media to say, guys, let's strive for zero positive PCR rate in our facilities. In our facilities, we shouldn't be, it's 2023, we shouldn't be still having newborn babies who are born with the virus. I think the one thing that is slightly still lacking is the education of the importance of adhering to treatment as pregnant moms, as even as fathers, because at the end of the day, as a pregnant mom, I can be adhering to treatment, but if my sexual partner is not adhering, then that means I'm not going to be virally suppressed, and I'll be transmitting the virus to my children. So we are working, we are doing well, but the latter 95, it's still a struggle in the country.
Yeah, and it's it's a continuous education, because there's always new people that come in that are tested positive for the first time and that are completely clueless. So we can never stop with educating, and so as healthcare professionals, we must be so aware of it. But as you said, we've made lots of positive strides, which is amazing. I love to hear all of that. And to go for an HIV test is not really a thing that you're full of shame about. It has become quite normal, and that is really great. The stigma around HIV has changed, if I'm correct.
It has changed. I think that there could be more information that is made available to the public to further encourage people to destigmatize HIV. Information such as U is equals to U, the tool that we're currently preaching in the country. It's being launched by the South African AIDS Council, which is SANAC. It's been launched in various provinces, and luckily provinces are coming on board. But I feel such information, Doc, will be information that will attract people to be in relationships with people who are living with HIV, knowing that they are safe. Because what perpetuates stigma is actually fear above everything else. The moment I disclose to a young gentleman that I'm HIV positive, the first thing they think of is, this girl is going to infect me, and they choose to run away. But what they don't know is that if my virus is suppressed, if my virus is lower than detectable limit, I will not be able to transmit it to the next person. I always say to the people that I talk to, you are actually safer to be with someone who is living with HIV taking their treatment than to be with someone who doesn't know their status. Because if I don't know my status, it means I might be infected and my viral load might be high, and just one encounter with you will be infected. But with someone else who's on treatment, has been on treatment, virally suppressed, one encounter with them, even if it is not a protected encounter, if that particular person is not is virally suppressed, that person will not infect you. But our public still doesn't know that. Our public still feels the need to run away from someone who's living with HIV because they think this person is going to infect them. So it's more a matter of people don't have information. People do not know. Hence, I'm saying health education can never, ever lose its significance when it comes to what we are trying to achieve in terms of conquering the epidemic.
Totally agree with you. So Zanella, you have an opportunity here to give health education. I just see that I'm offline. Can you still hear me? Well? Okay. So because you and me, we're familiar with all these terms, but our listeners, let's just assume that they don't know much about HIV. So what health education is what they really need to hear about HIV. They might not even know what it means to have your viral load being down there and low, what it means, you know? Mm-hmm.
And I want to speak from a perspective of relationships, because that's where conception comes from. That's where children are involved. I always say that in a relationship, you need to know your status and you need to know your partner's status. And if one of you is HIV positive and the other is HIV negative, that doesn't mean that now it's the end of the relationship. And I often advocate for couples counseling, even when couples are trying to conceive or couples have children that are going for immunizations. I always advocate, even when I was still working for Department of Health, I would encourage my mummies and my mummy-to-bees to bring their sexual partners, because this condition doesn't only affect the person that comes to the facility, but it also affects the sexual partner. So knowing both your statuses, if your statuses are different, the other one is positive and the other one is negative, that means you both need to attend the clinic together. One must not assume that just because I'm HIV negative, then it means I'm safe. This one is the one that needs to be responsible. It is both your responsibility to ensure that the other person does not infect the other person, and the other person who is HIV positive remains on treatment, not because they are not supposed to transmit their virus, but also because it is good for their health. We don't want them to have other diseases such as TB, meningitis, pneumonia, which are diseases that affect a person who is living with HIV if they are not taking their treatment correctly. Because if you don't take your treatment correctly, the virus attacks your cells in the body. It attacks your soldiers. That's what we call them. And in our term, we would say it's a CD4 count. So when we are taking your bloods at the clinic and saying we are checking CD4 count, basically we are looking at your immune system to say, is it strong enough to fight any invader that can be TB, pneumonia, or meningitis? Because we don't want you to have a system that is weak, that might not be able to fight off all these other infections. So it's important as partners to always go to the clinic together, so that you can have a chance to sit with a healthcare worker and discuss these things. What I don't like, Doc, is our people go into facilities and us as nurses, we prick them with needles, take bloods, and at the end of the day, we do not discuss these bloods with them. On the second visit, our patients come back and we say, oh, your bloods are fine. There is nothing such as bloods are fine. That's not how we interpret bloods. We need to tell our patients to say, we took a CD4 count, we were checking your immune system, it is great. We took a viral load. A viral load is the amount of the virus in your blood that we are able to see when we are taking the blood to the laboratory. And when we are saying it is lower than detectable limit, we are not saying the virus is not in your blood, but we are saying it is so low, it is so suppressed that when we look through our microscope in the labs, we are unable to see it. It is there in your body, but it is not at a level that it might be dangerous for your body. Hence, we say a viral load is undetectable. And then when it is undetectable, it is untransmittable. What we mean by that is a viral load that is so low in your system, it becomes so low that you are unable to pass it on to the next person, which is the tool that we are trying to use now to encourage people to stay in discordant relationships. These are relationships where the other partner is HIV positive and the other partner is HIV negative, because transmissions occur between people who are moving from one relationship to the other without knowing the next person's status. Often, many a times on social media, I get inboxes of partners saying, I'm running away. I just found these pills. I'm leaving this relationship. And I always say, if this partner that you are with is an honest person, is someone that you want to spend your life with, you would rather stay with this partner who's on treatment than going to meet a Zanele whom you don't even know, who has never taken an HIV test. So I think the one thing that I would like our clients to know who are living with HIV or who are dating people or married to people who are HIV positive is that your partner's HIV status is not only their responsibility, but it is also your responsibility to ensure that the virus doesn't spread in your family. I mean, if me and my husband don't have a child and I'm HIV positive, my husband is HIV negative, we have a high chance of having a child that is born HIV free if I take my treatment correctly and my partner is supportive. But if I don't have a supportive partner, if I have a judgmental partner, a partner that speaks ill of HIV, then that means I'm going to hide my treatment. I'm going to hide my pills because I don't want my husband to divorce me. And not everyone who is HIV infected is infected because of promiscuity. I think the issue comes from the story behind HIV being sexually transmitted. People automatically assume that it is a disease that affects people who are are promiscuous, but that is not what it is. Some people were born with the virus, and when we look at our progress in South Africa, PMTCT was introduced in 2004, and that actually means that the children who were born before 2004 might have been born with the virus. And most of them are teenage now, and some of them are youth, some of them are semi-adults, they are dating, some of them, they are sexually active. So if we do not eradicate stigma, if we do not understand the story behind HIV, then we stand a great chance of still getting new infections. So for people and information is everywhere now, Doc, really. Ourselves, we are on social media, we are preaching these things. So information is literally at the tip of your thumbs. You can type on your smartphone and you will get all the information that you want. But people just need to educate themselves with HIV.
Yeah, you said so many important things. Thank you, Zanelle. So let's just take it a little bit forward to women that are living with HIV and motherhood. Okay, so because there are many of them. What are their biggest fears and their biggest challenges?
Their biggest fears is transmitting the virus to their own babies. Just yesterday, I received an inbox on Facebook, and this lady says, I am scared. I am scared of transmitting the virus. I have a 3-week-old baby, and I am scared of transmitting the virus to my baby because with my firstborn, I had a terrible experience. And from that, I gathered that the firstborn might be living with HIV, and she doesn't want to repeat that mistake again. And this is something that I always tell healthcare workers, that there is no woman in this world who wants to transmit the virus to their babies. None. Many a times when I converse with my colleagues to find out why are we still having positive PCRs, my colleagues normally says to me, but Nurse Z, we tell our patients all these things. We give them all the information, but our patients don't listen. And I always say to them that at nursing school, they don't teach us to tell our patients. At nursing school, they teach us to educate our patients. When you tell someone, there are chances that this person will not listen to you. But when you help educate a person, that comes with understanding. So sometimes we do tell our patients, but our patients do not understand because we are telling them. But when we educate them, they then understand what we are talking about. If a pregnant mom or a newly delivered mom comes into my consulting room, and all I do is to give them a nevirapine and say, give 5 meals every morning. And they go, they leave. They don't get to ask me questions. I don't explain anything. I don't tell them how long are they going to be drinking that nevirapine. Nevirapine is the drug that we give them for prophylaxis purposes to prevent the transmission between the mom and the child. And if I don't tell them what the nevirapine is for, why should baby be taking nevirapine? How long should baby be taking nevirapine? That woman did not understand anything. They just heard me saying, give baby medication 3 times every morning. This is how much. Now this woman will leave my consulting room with fear of infecting the baby because she doesn't understand that this medication actually prevents the child from getting infected. And with so much fear, they get clouded. They are thinking, they even forget the instructions that they were given at the clinic. They will come into our DMs and say, Nazi, I can't even remember how much medication did they say I must give to baby or how long. So moms are very scared of infecting their kids. Moms are still not acquainted with how the prophylaxis work around their children. Moms are concerned about the well-being of their children, particularly when it comes to breastfeeding. A lot of mothers who are living with HIV opt to exclusively not breastfeed because they are scared of infecting the baby. But the reality of the matter is, if we educate them well enough to understand that untransmittable viral, undetectable viral load. It is untransmittable even on the breast milk. If we can educate our mothers, I think that would alleviate the fear and the anxiety that they have.
Yeah, excellent, excellent. So it again boils down to empowering our moms with the right knowledge. Yeah, because empowerment reduces fear. So that is what it is. So if you're listening and you find yourself fearful and you feel like I don't have enough information, then go reach out to people like Sanele or the Google. I think Google, as you said, it's all there, because there's no reason to be fearful. It's actually very doable these days to be a mother living with HIV, and even to breastfeed completely your baby without transmission. So, Zanele, now, what do women need to know that are HIV positive? Is there anything they can do preconceptionally already if they want to be pregnant?
I always tell moms that before you can fall pregnant, you need to know about your blood results and your health status. With your health status, we are talking if you have any sexually transmitted infections such as syphilis, gonorrhea. These are things that you can test before you even fall pregnant. And this is a process that one should do with their partner, with their sexual partner. Then after you get screened for these diseases together with HIV, and if you are already living with HIV, I always advise moms to know what their viral load is. And like I said, viral load is the amount of viral copies of the virus itself, its copies, its babies on your system. You need to know how much of the virus do you have in your blood. In that way, it will tell you to say, do you have chances of transmitting the virus to the unborn baby or not? And it will tell you to say, are you taking your treatment correctly or not? And if your viral load is still high, your healthcare worker will health educate you. Your healthcare worker will teach you better ways to adhere to your treatment, to take your treatment correctly. And you also need to know your CD4 count. Like I said, CD4 count is your soldiers. Is your body strong enough? I mean, pregnancy is a condition. Pregnancy is a condition, and your systems gets to operate differently from when you are not pregnant. So it requires your body to be strong enough to carry you and baby so that you don't become sickly, so that your system does not get attacked by opportunistic infections. So things such as viral load and CD4 count as a wannabe mom or wannabe parents, it's very, very important. And if you are a woman who is in a relationship with a man who is living with HIV, I also recommend PrEP. PrEP is what we call pre-exposure prophylaxis. This is a drug that we use daily. You take one pill every day, and it protects you from being infected with HIV. And someone might say, oh, Zanele, but my husband is lower than detectable limit. There are so many things that can really interrupt the virus in one's body. There are so many things that can make one's body to not have a virus that is lower than detectable limit. And data currently is showing that for us to say one cannot transmit, the virus needs to be less than 200 copies. So if it's 201 copies, 202 copies, 205 copies, that person can infect the next person. So if you are now trying to conceive, we don't want to risk you getting infected and baby getting infected. So it's very, very crucial for a wannabe mom or a pregnant mom to get themselves on PrEP. It's not a drug that has a lot of side effects. I know social media, we've got social media influencers who are not healthcare workers, and they sell all these other things, and I cringe all the times I see them. But it's a drug that is effective. It prevents one from getting infected with HIV. So I also highly recommend it. So if one is taking supplements, you might as well just take PrEP as well.
So, Zanele, where can one get a PrEP? And is it a drug that you take just when you're going to have sexual activity, or do you take it all the time?
So PrEP it is found in our private and public healthcare institutions. A doctor can prescribe a script for you to go and get it at pharmacy. It is an ARV drug. It's one of the drugs that we use to manage HIV. So I'm making this known because people do find these containers and they say, oh, this looks like an HIV medication. Am I HIV positive? It's the same drug, but it works differently. It serves a different purpose. So it also can be found in our public institutions. Back in the days, we used to give it to high risk people, but now we give it to everyone who feels they are in need of the drug. So you take one pill every day, like we do with the contraceptive pill. You take it once every time at the same time. There is another method that is called 2+1+1, but that one is a method that is often used by the LGBTQI community. It means you take 2 drugs of PrEP 24 hours before sexual intercourse, and then you take one drug 24 hours after, and then you take the last drug 48 hours after. But I do not recommend that particular method for regular people who are in relationships where they are staying together. This one works best in relationships where sexual intercourse is being planned in advance. So we recommend it mostly to the LGBTQI or the men who have sex with other men. But yeah, for our mothers, I would recommend the daily dose prescription of PrEP.
For if you're living with a HIV positive partner, or
if you are living with HIV,
Yes.
yes. If you're living with a partner who is HIV positive.
Okay, wonderful. All right, so then let's just talk quickly about women living with HIV, what I need to know during pregnancy. What is specifically important in pregnancy?
So during pregnancy, as a mom who's living with HIV, you are going to be monitored viral load. And like I said, please ask the nurses, you're going to go back to the clinic. Please ask the nurses to say, what are my results? They must not just say fine. They must tell you to say, oh, you are lower than detectable limit, and this is what it means. Or you have 400 copies. This is what it means. They need to know their CD4 count as well. They need to know their creatinine clearance. They need to drink a lot of water, please. They need to drink a lot of water for kidney purposes. And I don't think this is just for women who are living with HIV, for everyone in general. But for people who are living with HIV and who are on the drugs are quite robust, and they like any other drugs, they have toxicity in them. So with a lot of water, it helps cleanse the system. So I do recommend a lot of water. Let's ensure that we do not miss our ANC dates, our appointments with our clinicians. They are very significant. So viral load is monitored. We get to check the viral load of the mother, particularly one whose viral load is not suppressed. We check it. I think it's three times during pregnancy, each trimester. Every after three months, we check a viral load for a mother who is not suppressing. And the mother needs to decide while pregnant if they are going to exclusively breastfeed baby, or they are not going to breastfeed completely. So we do not mix feed our babies because the stomach of the baby gets to be eroded, and that may be an opportunity for infection if there's going to be any infection. So we do not want any of that. To the grannies at home, please don't give baby water. I know grannies like giving babies water with sugar. We do not advocate for that. Baby only gets to have exclusively breast milk from mother, or they get to only be fed bottle feeding if they are bottle feeding. So a method of feeding, it is very, very, very important, especially for the mothers who are living with HIV. So they need to decide on that. They need to also know that there are going to be medications that are going to be given to baby at delivery. And baby will be tested. We are going to test baby to make sure that baby doesn't have HIV. And even with that, there are intervals that are followed. during those procedures. So pregnant women during pregnancy must be at ease and enjoy their pregnancy like any other pregnant mom. They must not occupy their minds with, oh, am I going to infect baby? Am I going to infect baby? As long as you are following the information and the instructions that are given to you by your healthcare worker, then we are going to be fine. Because at the end of the day, if you are going to constantly instill anxiety in you of, am I going to infect baby? Am I going to infect baby? That might even cause you to have what we call postpartum depression, and we do not want that.
Wonderful. So you've already skipped some of my questions for birth and breastfeeding. Is there anything else that is important for during labor and birth? A woman can give birth naturally, right?
Yes, a woman can give birth naturally with women who are living with HIV. Women must not say, I'm opting for cesarean section because I'm HIV positive. I don't want that. I don't want women to be scared of breastfeeding because they are living with HIV. The current drug that we have, which is dolutegravir, well, it's not that new anymore because we started using it in 2019, but it is such a robust drug when it comes to dealing with HIV and suppressing the virus. So if you are living with HIV and you are not suppressed during pregnancy, I do highly encourage you to be adherent, to take your treatment correctly, because the data has shown that the viral load can be suppressed with dolutegravir in a space of 3 months. And I know when dolutegravir came into the field, there were data showing that it was causing neurotubal defects in other women. But it has been cleared now that we do give it to pregnant moms, to even women of childbearing age, because back then we were not giving it to women of childbearing age. But the nice thing about science is that the more investigations and research are done on it, new information comes up, and it helps us to be able to assist a larger population. So even with dolutegravir, I want to say to new moms, fear not. We can now take the drug, and it is safe for us. It is safe for our babies, and it actually benefits us because it suppresses the virus really quickly. So it gives us opportunities to make decisions freely without fear of transmitting the virus to the baby. So you can decide that I'm going to breastfeed, I'm going to have a normal delivery, and I just want to experience everything the way nature wants it to happen. Yeah.
Yes. Thank you for clearing that, because I'm sure that was a question for some. And we are all pro-natural, so that is really, really the best way to give birth. Sanele, if I summarize our talk, then I mean there's so much to know about HIV, but for someone that is not a medical professional, I think the bottom line is that you must just be on top of it and go to your healthcare professional regularly. Make sure you have your bloods taken. Make sure that you take your tablets as prescribed. Then that is sort of the baseline, because the medical people and the researchers, they've done all the hard work to keep up with the latest research and the right medication and what to take. But if you just keep going to your healthcare professional and take ownership of your health, then you're really, really very safe. And you really can have a normal life, and you can have a family and be happy. Yeah. Right? Yeah. Yeah. So, because there's so many things I actually want to pick your brain on, because there's lots to know about it and new developments. But I think for this is like the bottom line that we want to achieve for today's talk, is just like, make sure that you are on top of your game. Don't just ignore it like it's not there, or don't be quiet about it, but just own your status and own your health, and be in control. And there's everything available for you to really live very well with the virus. So now we've spoken about everything, birth and breastfeeding, Sanele, and unfortunately there are some babies maybe that do get the virus. as much as it is a small. Let's lastly touch on that. What if that happens? What happens to that baby that attracts HIV?
So, you're taking me back to the days when I was in the facilities. I think it is quite, Doc, whether you have a child or you don't have a child, children are just innocent people.
Yeah.
And I think what I want to ask from mothers is to take ownership of that situation. Because the worst thing that I have seen, Doc, is a child being born with HIV and the parent not wanting to take ownership of that situation. You can never be able to uninfect the child. The child is already infected. The best thing that you can do now is to ensure that this child's quality of life does not get degraded because of the virus. So we've got what we call adolescents and youth friendly services in our clinics, right? And these are clinics that are meant for young people, particularly young people who are living with HIV. But they are also meant for young people so that we prevent them from being infected with HIV. What I've discovered in the past is that parents don't know how to disclose to children. Parents leave children until they are 18 to want to disclose. And at that age, the child has already found out for themselves what HIV is, what they have. If you are a mom and you are listening to this podcast and you've just discovered that your child was infected, I want you to make it your responsibility to ensure that your child's life doesn't get degraded because of the virus. And you can do that by equipping your child from an early age about the knowledge of HIV, what it means, how they got it, and what it means for them as adults. Disclosure starts from the age of 3 years old. I know you moms are probably thinking, oh, Zanele, a 3-year-old understands nothing. But there is a language that we use when it comes to speaking to children about diseases. Even teachers do speak to children about diseases. So there's a program called Kids Alive, and they trained us on how to disclose. They've trained a lot of healthcare workers, counselors, and registered nurses in facilities. So if you're a mom and you are not confident, if your child is going to turn 3 in the next 3 years, I want you to start having those conversations with your healthcare worker now. You are not going to wait until the child turns 3. If the child is 6 months old now, you are going to start having those conversations with your healthcare worker so that your healthcare worker can better equip you with knowledge and information of how you are going to navigate and help this child with their life from the age of 3. If your child is already 3 years and you're listening to this, so I'm just going to give snippets of how we do disclosure in children. So from the age of 3 years to 9 years, we teach them about the virus, but we don't call it a virus, we call it a germ. So at preschool, they teach them about germs, that you must brush your teeth. If you don't brush your teeth, there are germs and you will get sick. Germs makes us sick. Let's wash our hands so that we don't eat germs, right? They teach them, the teachers teach them about germs. So even with us in healthcare, we call the virus a germ. So from the age of 3 to the age of 9, we call the virus a germ. We tell them to say, you have a germ. This germ does not die. It only sleeps. So what that means, it means the germ does not get cured. It gets, it only gets suppressed. So die means cured and then sleep means suppressed. So we tell them that the germ does not die. It only sleeps. And it sleeps only if you are taking your medication. So if you don't take your medication, the germs, they rise up, they wake up, and they kill your soldiers. Children know what soldiers are because they teach them on career day at daycare. They know that soldiers care and soldiers kill anything that threatens people. So we tell them that you've got soldiers in your body, and the germ, if the germ doesn't sleep, it will kill your soldiers. That teaches this child from the age of 3 to the age of 9. It teaches this child that every night, even if I'm playing soccer with Sipho, When it's 7 o'clock, if I don't go to my house, the gem is going to be up and the gem is going to kill my soldiers. No child wants their soldiers to die. So when it's 7, they run to the house to take their medication. They have a reason why they are taking the medication. This helps us to raise adults that are not going to have what we call pill fatigue, where an adult no longer wants to take the ARVs because they are tired of taking the ARVs. But taking the treatment with the purpose, knowing why, it helps us to have adherent children. So from age 3 to 9, we call it a gem. And then when they turn 10 years old, we also inform them to say, you're constantly going to be going to the clinic to see Sister Zanele. Sister Zanele is going to be checking your bloods to see if the gem is sleeping, right? They need to we're pricking them with needles every now and then, so that they do not hate going to the facilities. And at 10, we then sit them down to say, do you remember the gem that we spoke about when you were young? Well, the gem has a name now, and the name of the gem is actually HIV. The child is not going to be shocked and say, oh my God, I'm HIV positive. No, they're not going to do that because they've known all along that they are living with the gem. But now we are giving the gem a name, and the name is HIV. And even when other children at school, they are speaking about HIV, this child of ours, because we disclosed at the age of 3, will not feel bullied because we empowered them with knowledge from a very tender age. They know where they got the gem. So when they hear people talking about, oh, this one sleeps around, that's why they are HIV positive, they will not think, oh, does that mean I also slept around, but I didn't sleep with anyone? Because that's where we get the confusion from adolescents to say, but everyone is saying this thing gets through sex. I never had sex. Why do I have it? So if you're a mom and you've given birth to a child with HIV, my plea is for you to ensure that you capacitate your child with information, with knowledge. You empower your child with information, with knowledge to be able to navigate their lives with the virus and not feel like their lives are being degraded or taken away from them. And for you as a mom to be able to do that, you need to engage with your healthcare workers, because even myself, I didn't just wake up and know all this information. I was trained so that I can be able to equip mothers. So mothers who have given birth to their children, I don't even want them to feel ashamed. I want them to go to the facilities to say, look, sister, this is what happened. I cannot change it now. I want to take ownership of what happened. I want to support my child. I need you to empower me. I need you to equip me so that I can better equip my child.
Excellent. That is so beautifully said and so practical. Thank you for doing that, Sanela. I didn't ask you to talk about this. So I put you on the spot, but I just thought about it because it's sort of the end story of sometimes babies do attract the virus. It still happens. So wonderful. So we're not going to let the virus win. We are winners, right? What the virus is not going to win. So we are at war with it. Thank you for all you do for in and around this area, Sanela. Such beautiful and important work. I absolutely loved listening to you and talking to you. So thank you so much.
Thank you so much for having me, Doc. I truly feel honored to be on this platform.
No, it's absolutely a pleasure. So now, where can people find you if they want to reach out? Is that a possibility?
Yes, Doc. I have a YouTube channel, in actual fact, that covers most of the things that we spoke about today. I've got a series of videos where I spoke about preparing to conceive as a mom living with HIV, and during pregnancy, after pregnancy. The name of the YouTube channel is This is Ness Z. And I am also on Instagram, and the handle is @IamNessZ. I do HIV content as well over there. I'm on Facebook. I have a Facebook page that is called NessZ. I also do HIV content there. And I'm also on TikTok now. It's also @IamNessZ. Yeah.
Awesome.
I can be reached on those handles, and I do answer DMs. So if someone has a private message, I will definitely answer.
Awesome. Well, we will put those details in our show notes that the mommies can find you. Wonderful. Thank you so much. And we will stay in touch. Thanks, Anel.
Thank you, Doug. Thank you. Bye.
Bye. Thank you so much for joining us today. If you enjoyed this video, please share this with a friend who will benefit from this. And remember to subscribe and hit the bell icon so that you can be notified whenever we release new videos like this on our channel. We'd love to stay in touch and keep you updated with all our latest content and resources to equip and empower you. So if you're a midwife or any type of birth and baby worker, go to sensitivemidwifery.co.za/free gift. If you're a mom, visit sisterlillian.co.za/free gift for more training and resources. That way we can keep you up to date when we release new episodes like this, plus a few other bonuses. You can also find the links I just mentioned in the show notes. Remember, you're making a big difference because you are shaping the future of humankind. Thanks for watching, and I look forward to journeying with you.